Hi everyone and welcome to my channel. Today we are going to talk about the ulna bone. The ulna is a long bone in the forearm which lies medially and parallel to the radius bone, the second of the forearm bones. Proximally, the ulna articulates with the humerus at the elbow joint. Distally, the ulna articulates with the radius to form the distal radio-ulnar joint. Now we will look at the detailed anatomy of the ulna bone. For our easy understanding, we will divide the bone into three zones: the proximal ulna, the shaft of the ulna, and the distal ulna. Now the first structure that we are going to look in the proximal ulna is the olecranon process. The olecranon is a large superior projection on the proximal part of the ulna. It curves anteriorly at its top, forming a prominent tip. It is accommodated by the olecranon fossa of humerus during forearm extension. Now here you can see the olecranon process in the olecranon fossa. In an extended elbow, it helps in the locking of the elbow joint. Now we will look at the anterior aspect of the olecranon. The anterior aspect of the olecranon contains the proximal portion of the trochlear notch. Now let's have a look at the insertion sites that the olecranon provides for the different muscles and the ligaments. The first structure that we are going to look at here is the ulnar collateral ligament. Okay, let's isolate the structure so that you can see it more clearly. Here, look at the transverse part of the ulnar collateral ligament. As you can see the attachment at the olecranon process. Let's have a look at the muscular attachments at the olecranon process. The two muscles that attach at the olecranon are the anconeus muscle and the triceps brachii muscle. Next structure in the proximal ulna is the coronoid process. The coronoid process of ulna is the broad anterior eminence on the proximal part of the ulna. Look, this part is the coronoid process. The superior aspect of the coronoid process contains the distal portion of the trochlear notch. The lateral aspect of ulna contains the radial notch, which provides articulation site for the radial head. On the medial aspect of the coronoid process is the sublime tubercle. The sublime tubercle is located here. Let's have a look at the attachment of the ulnar collateral ligament at the coronoid process. The ulnar collateral ligament is attached superiorly to the medial epicondyle of the humerus and inferiorly to the medial margin of the coronoid process. The next attachment is the insertion of the brachialis muscle at the coronoid process. Let's have a look at the isolated view of the brachialis muscle. Look at the attachment at coronoid process. Next structure is the tuberosity of the ulna. The tuberosity of ulna is a large, rough, elevated area found on the anterior surface of the ulna. It is located inferior to the coronoid process and provides insertion for the brachialis muscle. Next structure is the trochlear notch, which is a large concave area found on the anterior superior aspect of the proximal part of ulna. It consists of two articular portions. The proximal articular portion is found on the anterior aspect of the olecranon. The distal articular portion is found on the superior aspect of the coronoid process. The trochlear notch articulates with the trochlea of the humerus to form the humero-ulnar joint, contributing to the formation of the elbow joint. Next structure is the radial notch, which is an articular indentation found along the lateral aspect of the coronoid process of ulna. It is a smooth and articular surface. The anterior and posterior margin of the radial notch provides attachment for the annular ligament of the radius. Let's have a look at the isolated view of the annular ligament. Now you will see the attachment of the annular ligament at the anterior and posterior margin of the radial notch. Moving along to the next structure is the supinator crest located along the lateral aspect of the body of ulna. The supinator crest extends inferiorly from the posterior edge of the radial notch to the interosseous border of the ulna. Last structure at the proximal ulna is the sublime tubercle, which is a small prominence found on the medial aspect of the coronoid process of ulna. This sublime tubercle provides an attachment site for the ulnar collateral ligament. You can see here the attachment of the ulnar collateral ligament at the sublime tubercle. Now coming towards the shaft of the ulna, we will study the borders and surfaces here. First, we will start with the borders of the ulna. The first border that we are going to look at is the anterior border of ulna. It is a thick margin located along the anteromedial aspect of the body of ulna. It extends inferiorly from the medial edge of the tuberosity of the ulna to the ulnar styloid process. The next border is the posterior border of ulna. It is a subcutaneous margin located along the dorsal aspect of the body of ulna. The posterior border of ulna separates the medial and posterior surfaces of the ulna. It extends inferiorly from the olecranon process to the ulnar styloid process. The last border is the interosseous border of ulna, which is a sharp margin located along the lateral aspect of the body of the ulna. It extends inferiorly from the supinator crest to the distal part of the ulna. The interosseous border of ulna provides an attachment site for the interosseous membrane of the forearm. Coming towards the surfaces of the ulna, the first surface is the anterior surface of ulna, which is located along the frontal aspect of the body of ulna. It is bounded posterior-medially by the anterior border of the ulna. Laterally, it is bounded by the interosseous border of the ulna and the supinator crest. This surface is the anterior surface. Next surface is the medial surface of the ulna, which is a smooth area on the posterior medial aspect of the body of ulna. It is bounded anterior-medially by the anterior border of the ulna. Posterolaterally, it is bounded by the posterior border of ulna. Last surface is the posterior surface of the ulna, which is located on the posterolateral aspect of the body of ulna. It is bound anterolaterally by the interosseous border of the ulna and supinator crest, and posteriorly by the posterior border of ulna. This surface is the posterior surface. Now we will come towards the distal ulna. The distal ulna can be divided into three parts. The first one is the head of the ulna. The second is the articular circumference. And the third is the styloid process. The head of ulna is the round, expanded portion on the distal part of the bone. The articular circumference of the head of ulna articulates with the ulnar notch of the radius, forming the distal radio-ulnar joint. Here you can see the distal radio-ulnar joint. The distal radio-ulnar joint is the joint The articular circumference of the head of ulna articulates with the ulnar notch of the radius. The second articular area is the articular facet of the head of ulna. It will attach to the articular disc of the distal radio-ulnar joint. Here you can see the attachment with the articular disc. Last structure is the styloid process of ulna. It is a subcutaneous cylindrical projection which is found on the posterior medial aspect of distal part of ulna. It provides attachment to the ulnar collateral ligament. Here you can see the ulnar collateral ligament attached to the ulnar styloid process. That was all for today. Thank you.